Good day and welcome to the GHA GDDS User Group Conference Call. All lines are now fully interactive. Please be aware that any background noises, conversations, or placing your line on hold will broadcast into the conference. Please utilize either your phone's existing muting function or via touch-tone phone, you can press 61# to mute and 60# to unmute. Please also note this call is being recorded. I would now like to turn the conference over to Leslie Sanovich.
Good morning and welcome to today's call. We appreciate you taking some time out of your schedule to join us. Can everyone hear me okay?
Yeah.
Yes.
Great, thank you.
Thanks.
And you should be able to see my screen. On the call from GHA, we have Bill Wiley and Sharifa Navos, so we welcome them as well. Don't have a terribly full agenda this morning, but do want to go over a few things. Our 2019 data submission schedule and publication. Bill's going to give us an update on the readmission module and also the GDDS services and invoices that have been distributed. We'll talk about, Sharifa's going to give us a presentation on the data services portion of the GHA website. We've moved some information and forms and helpful files over to that website, our website for you. And then we're going to talk a little bit, in previous calls we talk about reviewing the submission reports from HeidiNet. Many of you do submit your data, but there are many of you that are just simply users of the visualization tool. So we wanted to talk about, since we're getting towards the end of the submission for the 2018 discharge data, how you can help your facility make sure that that 2018 year, the distribution of payers and patient types looks appropriate. So wanted to just walk you through a couple of those scenarios on how to begin reviewing some of that data. And then, as always, we'll open it up for questions and anything you might like to see demonstrated on the visualization tool. As always, I like to quickly go over what the Georgia Discharge Data System is. It's a state-mandated law that hospitals submit their data to the Department of Community and Public Health, and we are the vendor for the state. And we use Heidi, who is a subsidiary of the Missouri Hospital Association. They've been collecting our data for over a decade, and they do a really nice job. And so hospitals submit their data in the UB04 Georgia data format. That data is processed, and different geographical codes are assigned, DRGs are assigned, checks and validation are performed programmatically, and then while that is happening, Sharifa is constantly monitoring data being submitted, making sure volumes, distributions look appropriate on a monthly basis. Once that data is compiled and validated, it becomes what is known as the Georgia Discharge Data System, and GHA receives access to that. We provide that then to our other vendor, Javion, who makes the data available to all of you through the visualization tool that we are using now. We also send that data to the Brain and Spinal Trust Fund Commission, the state of Georgia, the Agency for Healthcare Research and Quality, and to HCUP, the Healthcare Cost and Utilization Project. So that is just in a quick overview, a visual of what happens to the data. This is our GDDS schedule for 2019. So currently we are receiving December data, which is due on next week on the 15th. And this is our yearly schedule, and Sharifa is going to be showing us where you can find this schedule and the 2018 schedule on our GHA Data Services webpage. Bill, I'm going to punt to you now to give us an update on the readmission module and also our annual invoicing.
Thanks, Leslie. We are just about ready to roll out the readmission module. We're doing some testing on logins. So what we're going to do is roll out this week with about 10 different folks amongst hospitals and systems, just to make sure that all that login works and we've got that process set up. But the readmission module, we think will be ready next week, and it will have access again to everyone that is a GHA member. State Office of Rural Health helped us pay for the development, but we're going to roll it out to everyone. So there's 2 forms, and we've talked about this in the past. Since you can actually drill through and get to the patient record for that facility, we've got 2 forms that we want to recognize. One of them is for a CEO, just to recognize that their people will be able to download and access PHI. And then the CEO can then list the users that they would like to have access, and then there's one for the users to acknowledge that they've been trained on how to handle PHI and things like that. So those 2 forms, if you haven't gotten them, just shoot me or Sharifa an email. We can get those forms to you and get you guys set up for that first of next week. The other thing that Leslie wanted to talk about was the invoicing. We went to a new customer relationship management system last year, which has forced some timing things with invoicing. So we had to invoice, and some of you may have already received the invoice for the 2019 GDDS. Some of you may be getting it in the next week or so, or it may have gone to someone else and they're just going to ask you about it. I know that in the past we've invoiced in April, May, early June time frame, because that was when we closed out the previous year. So some hospitals have been putting this in a particular fiscal year. Don't change what you've done based on our time for invoicing. If you've always done it as a calendar year, fiscal year, fine, do it as you've done. If your fiscal year starts in June and you need to wait because this is actually going in next fiscal budget, that's fine too. If that's the case, though, let us know and we'll go ahead and flag it in the system so that you don't keep getting statements and things like that.
All right.
But, you know, that the timing was moved up because our CRM system is forcing us to move things up that are, quote, renewals like that. So we just didn't want any confusion over folks going, you know, I usually don't get this until late spring, and I'm getting it now. So that's the reason. You pay it when the fiscal year that you've got it budgeted in, and we'll work with you on that. So I'll turn that over. Anybody got any questions on either one of those? If not, I can turn it back over to Leslie.
Thank you, Bill. And also, just moving forward, you can anticipate that the billing for GDDS will happen in January of the beginning of the year, the new year, moving forward. So if that helps your budget process. Any questions regarding the readmission module or the annual invoicing?
Hey, Leslie. This is Mark Hayes. Can y'all hear me? Hey, thank you. I had a quick question from that. So I know you said it's nothing too much to worry about, but I'm looking at it. So is the December, from what I see in red, is that for everyone or is that more so quarterly, just in case I'm reaching out to my facilities?
It's an annual invoice.
Okay, perfect.
Yes.
No, thank you.
You're welcome. Good question. And if you have questions about your invoice, don't hesitate to give me a call. The amounts are based on volume of inpatient and ambulatory surgery patients, and it's based on the most recent year of complete data. So for the 2019 invoices, the most recent year of complete data we have is 2017. So I can go into more detail specifically regarding your facility if you have questions, but that's how that is determined.
Okay, perfect. Thank you.
You're welcome. And we are constantly trying to keep our our CRM system, our contact management system, up to date with the appropriate contact. So if you are aware of a change, or if you receive the invoice and you're not the appropriate person to receive that, please let us know so that we can update our records and get that to the correct contact.
Okay.
Hi, Leslie. This is Deborah.
Hi, Deborah.
Hi. Happy New Year.
Happy New Year.
This doesn't have anything to do with the limited data set, does it? It's a different invoice you're talking about?
No, it does not. The limited data set is a separate invoice, and those won't be invoiced because we won't be sending out that first quarter of data until June. And so we wouldn't begin invoicing for those that subscribe. We'll send those order forms out probably in April or May, and then we would not invoice for those until we release the first quarter of 2019 data.
Okay, thank you.
You're welcome. This time I'm going to ask Sharifa to give us a quick tour of where we have some of our data services resources, moving them to the GHA data services portion of the website. Sharifa?
Good morning, everybody. So this is the new location for most of our data services resources, and it's located on the GHA.org site. Many of you, I'm hoping, should have a login, but if you don't, you can just sign up with your work email, and this is what the page looks like. So once you go to GHA.org, you click on the login or sign up button, and then, input your username and password.
It's under Julie Brand. That's what I was telling you.
Let me remind everyone that we are on open lines, and we can hear a little bit of background noise. If you don't mind muting your line unless you have a question or comment.
Totally, and I'm having problems with the system.
Go ahead, Sharifa.
Yeah, so this is the sign-in page, and you can go to the next slide. So once you sign in, you'll see on the top some tabs, and the Data and Finance tab is where our information is located for data services, and you would just hover over that tab and click on Georgia Discharge Data System, which will take you to where the button is, and you can go to the next one. And this blue button called Data Services Resources, so this is where we'll be putting, Bill was mentioning, the authorization forms for Javion, the schedule for the GDDS monthly submission, and other things that we're still discussing that we previously had put on the Analytic Advantage website. So this will all be on the GHA website. If you go to the next slide, Leslie.
While we're still here, though, Sharifa, I did want to point out that this button next to it that says member reports are where you're putting the reports that are generated regarding like value-based purchasing, prospective payment, things like that. That's where those reports are. And if you need access to that member report, let Sharifa, that member report folder, because it's not the same. It's a special permission. Just let Sharifa know.
Yeah, so this is when you click on that button, you'll have different folders for data authorization forms, as I mentioned, the JVON strategic planning module, and where we'll be putting some materials in there for frequently asked questions and training and how to, even though it's a fairly easy tool to use, there's still some things that, we can all learn and we can all share and put in there so that people can reference and have access to it for whatever report they want to run. On the notes of the study, which is usually done quarterly, right now we have the one from 2017, like Leslie said, our most complete year of data, and then 2018, I have quarter 1 through 3, so you can click on that and look at it and just see what the distribution of data was for that quarter. And of course, we're going to have one for Q4 coming up soon, and then usually we'll have a final one around July. So those will be posted in there. And the strategic planning user group. So this user group usually is recorded, and so we'll be posting the presentation if you missed it or if you want to re-listen to it to get more information. And also the video of this particular user group. So Leslie's on the site now, and as you can see, you'll have your schedules and your UB04 record layout, and this is how it's set up with the folders by year, and also most of the files are in PDF format, so you can look at them and save them, for your reference.
And the way we're going to be handling the recordings, we'll be posting the link here, and the link will ultimately take you to a YouTube channel where you can replay these user group meetings. We will be able to post the PDF of the presentation, especially if it's a lengthy presentation. We'll be happy to post that PowerPoint, and we'll create a folder for the user group where we'll have, we have a folder here. So we'll be putting the presentations, we'll create a 2019 folder to have those presentations there. Bill had mentioned the authorization form for the readmission analysis. So there's one for a hospital system, and there's also one for individual hospital. And within those folders, there are two permissions. One that the first one that needs to be completed is by the CEO, for the CEO to list those people in the facility that he wants to have access, he or she wants them to have access to the patient level drill through, that sensitive information, and then the individual user acknowledgement form. So that's where that is located. And we hope this will be a good resource for you. Coming through the GHA website, there are a lot of resources here, and we wanted to make it as easy as possible. Any questions about this area of the GHA website? Anything else you would like to see put here?
This is Jay from Piedmont. I just appreciate you doing that. I was actually looking for some of this information last week and had emailed you, Leslie, and so glad to see it's online and easily accessible. So it's great. Thank you.
Thank you, Jay. Thanks for that feedback.
And if you have anything that you would like us to add, just email me or Leslie, or and we can definitely post that on there. And the more feedback we get, the better.
And Sharif is working on a couple of quote-unquote how-tos, step-by-step, for the visualization tool that we'll put on here for new users that we, and as we do some presentations one-on-one with people about how to get started, kind of a quick start guide, we'll post these on here as well. That might be helpful for new users or as a refresher. Well, then, like I mentioned, the next thing I wanted to talk about is Sharifa normally goes through kind of a demonstration on how to review the submission reports, the edit detail, the edit summary, and the verification reports, and those are very important. But we realize that not everyone on this call has access to those reports. Those reports are generated and are available to users who have access to the HeidiNet portal, where you actually are uploading that UB04 data. And if you don't know who uploads your data, please contact me or Sharifa, and we'll be happy to give you a list of those users that have access to that portal. But we thought it might be helpful to show you how you can help in the process in looking at data. And I'm not picking on Candler County. I'm on the JVon site right now, or Candler Hospital. But I just wanted to show you how you can sort of eyeball, if you will, your historical data. And of course, we're only through September 30th of 2018. But, you can see that their distribution, and this is for all patients. But if I wanted to narrow it down and just look at inpatients, I can do that. And so it shows me the distribution, which looks, pretty normal. If I wanted to look at a year of, the primary payer type, you just click on that year, that line, and it updates this. You can also look at the number of records by zip code. It lists the top ones or the most populated at the top, so you can kind of look at that distribution to see if that changes. Then if you wanted to compare what you had in 2017 to 2018, you just click on the next one and kind of look and see if it is consistent. We notice on the verification report that we're looking at 2 years historical year over year, but sometimes it's helpful to look at these the last 3 to 5 years or 4 years to find out if your data is consistent. And what this tool would do is if you saw an inconsistency, to ask that question of your billing department or to make sure that your volumes are accurate. We want this data to be useful and as accurate as possible. So I just would encourage all of the users to kind of experiment with this and see what you can play around with and looking at, I'm not sure why it's duplicating these, but we'll find that out. But if you wanted to look at your emergency room volume, every time you make a change, it's going to refresh this data. So hopefully
Leslie,
you'll find
this is Jay again from Piedmont. I know you're working on a few updates, but 2 quick things for feedback that we have found. The one is that there's no filter to remove normal newborns quickly, which means that all the other analysis that we have done isn't really comparable. And then also just with dates, not having the ability to look at fiscal year, especially with the way the data rolls out, ends up being somewhat challenging having it parsed out if you're looking over a fiscal year period with the date at the top. But on the left bottom section, it gives out calendar year, and trying to download that data makes some challenges.
Okay. Thank you, Jay, for that feedback. So I understand what Jay's saying. You also can break this out by quarter if you want to. And then you can even go as granular as month if you click here. But you would be able to see your volumes quarter over quarter here as well. Any other questions or feedback? Is there anything anyone would like demonstrated? All right, group. I don't have anything else on our agenda today. We just wanted to touch base with everyone, let you know about the readmission module, a reminder about the monthly data submission on the 15th of next week. Also mention a reminder about the GDDS annual invoices being distributed, and give a quick demonstration on the tool itself, and also to remind you that we want users of the visualization tool and also the HeidiNet users that are submitting the data to go on and begin your review of your 2018 submission. That submission will be, we're hoping to have all of that in by July 15th, so we can close the database at the end of July, the annual database. We will be doing global analysis on all of the data to try to see any inconsistencies or red flags that may pop up. And please don't hesitate to contact us with questions or requests for a one-on-one demo with your facility. We've been doing more of those, and we're more than happy to work with you on getting new users added from your facility. I know that Bill was at a meeting yesterday and had, I believe it was a CEO, Bill, got a new login and was excited to get into the tool. And go ahead, Bill.
Yeah, they sure did. We had to do a demonstration for the GHA board, and several of them asked for immediate logins, and I guess we're going to be making some trips to some hospitals to take the team and talk about the whole data program to their leadership. So it's good to finally get some of those CEOs to recognize that they can do a lot of this work that they've been outsourcing within their own hospital. So I thought it was a very beneficial presentation yesterday.
And you could also help us in the fact that if you have a new CEO or C-level or marketing person, to pass along the user authorization. We don't always know when there is turnover until we get a returned email, and we welcome the opportunity to work with new folks and get them involved with the tool. The last call for comments, questions, requests for additional demonstration on the tool today.
Hi, I have a question.
Yes.
This is LaTanya at Northridge. You were saying about go back and look at our 2018 submissions. Are you saying that we can go back and make corrections to them at this time before January 15th, or we're just kind of just looking at them? What we can and what we can't do is, I guess, that's my question.
Thank you, LaTanya. That's a very good point that I overlooked. Yes, that is why we want you to be reviewing your data, because you have until July to make your final submission and correction of the 2018 discharge data. So, yes, that is why we are asking you to go through with as fine-tooth comb as you can to review your data, to review the volumes of the patient types, review the volumes of the payer, review the volume of your ethnicity. You can do that on the reports Heidi gives the uploaders. Review by all of these, the discharge status. We just want to make sure that there's nothing out of the ordinary, that the data is consistent, and we can work with you on if you need assistance on how to correct data and resubmit to Heidi and replace data in the system. The way that process works is if you find an error on the data, that we ask you to update that in your system, so that obviously you want the data at your hospital, your facility, to be correct and complete, and then you would generate a new file for whatever time period that may be, and if it's a quarter or a month, whatever time period it may be, you would upload that into Heidi. You would replace a previous file. But we can certainly work with you if you need assistance with that.
Okay. All right, thanks. I just wanted to make sure that I can't go in there and, do things I don't want to go in there, and you guys were already pulled the data. So that's good. Okay, we'll do that. Thank you.
Yeah, we will close once we are satisfied with the completeness of the data in July, the end of July. We will wait until we're happy with it before we close the database, and then no other changes will be allowed to be made to the data.
Okay, thank you.
You're welcome. Any other questions or comments?
Hi, yes, I have a question. My name is Angela Allen from AU Medical Center. How do we know who within our facility has access to this view?
You can reach out to me or Sharifa, and we'll be happy to provide you with a list of users for the visualization tool, as well as the Heidi Online submission portal.
Okay, thank you.
Making a note, Angela, that you need that list.
Thank you.
You're welcome. Anyone else? Well, I won't let the silence go on any longer. We'll finish up today's call, and again, we appreciate your taking the time. I hope that you will go to the new GHA Data Services portal. If you do not have a login to the GHA.org website, it's very easy to sign up for, and there's a lot of good information. This Hospitals 101 that is now available is just a wonderful tool for anyone working in the facility, and I encourage you to review that. Our team worked hard to put that together, and we will look forward to talking with you. See again when our next meeting is March the 6th, and we will. If you have any items that you would like to discuss, please let me know. And in between then, if you have any questions, concerns, comments, please let Bill, myself, or Sharifa know. Thank you again for your time today, and we will look forward to speaking with you soon. This concludes today's call.
Thank you, Leslie.
Thank you.
Thank you.